Chapter 31, Medication Administration. The first United States law that regulated medications was the Pure Food and Drug Act. All this law does is require the medications to be free of impure products. The Food and Drug Administration enforces medication laws that ensure that all medications on the market undergo vigorous testing before they are to be sold to the public. Federal medication laws also control sales and distribution, testing, naming and labeling, and the use of controlled substances. The FDA did institute the Medication Watch program. This is a voluntary program that encourages nurses and healthcare professionals to report if a medication, a product, or a medical event causes serious harm to a patient by completing a Med Watch form. There are state and local medication laws that must conform to federal legislation. States do have additional controls, including control of substances that are not regulated by the federal government. Local governmental bodies regulate the use of alcohol and tobacco. Agency policies are often more restrictive than government, and the primary intent of Nursing Practice Acts is to protect the public from unskilled, undereducated, and unlicensed personnel. When reading this case study, think about how will Emilio and Esther establish priorities related to the medications. Chemical names for medications are rarely used in practice, and manufacturers, they choose their trade names that are easy to pronounce, to spell, and to remember. Think about Tylenol. Review Table 31.1 in your textbook. You're caring for a patient who has diabetes complicated by kidney disease. You need to make a detailed assessment when administering medications because this patient may experience problems with absorption, biotransformation, distribution, or excretion. The answer is D, excretion. When an error occurs due to the actions of a provider, it is considered a procedure-related accident. How will Emilio determine if Esther can understand her medications as well as afford her medications? Each route of medication administration has a different rate of absorption. For skin, the absorption is slow because of the physical makeup of the skin. Oral medications may pass through the gastrointestinal tract, and the overall rate of absorption for them is routinely slow. Mucous membranes and respiratory airways are absorbed rather quickly because these tissues have many blood vessels. Intramuscular injections and subcutaneous injections absorb more quickly than oral medications because these injections enter the bloodstream quickly. An IV medication produces the most rapid absorption because medications are delivered immediately into the systemic circulation system. The rate and the extent of the distribution depend on the properties, both physical and chemical, of the medication, and it depends on the person taking it and their physiology. Once the medication enters the bloodstream, it is carried throughout the tissues and the organs. How fast it reaches the site depends on the vascularity of the organs and the tissues. The membrane permeability refers to the ability of a medication to pass through tissues and membranes to enter the cells that are targeted. To be distributed to any organ, the medication must pass through all the tissues and the biological membranes of that specific organ. How well a medication binds to serum proteins such as albumin affects their distribution. Most medications will partially bind to albumin. This reduces the ability of the drug to exert pharmacologic activity. The unbound or the free medication is in its active form. Most of the biotransformation of the medication occurs in the liver, although the lungs, kidneys, blood, and the intestines also metabolize some medications. The liver is vital because it has a specialized structure that oxidizes and transforms many toxic substances. The liver is able to degrade harmful chemicals before they become distributed throughout the tissues. If there is a decrease in the liver functioning, like with aging or liver disease, a medication is usually eliminated more slowly. This will result in its accumulation, and depending on the individual, can result in toxicity. The kidneys are the main organs for excretion of medication. Some medications will escape extensive metabolism and they will exit or be excreted unchanged in the urine. Some medications will undergo biotransformation in the livers before they are excreted by the kidneys. By maintaining an adequate intake of fluid, which is considered 50 milliliters per kilogram of body weight per hour, this will promote the proper elimination of medications for an average adult individual. The nurse should know the desired therapeutic effect for each medication. This enables them to provide patient education and accurately evaluate the desired effect of the medication. Adverse medication effects can range from severe to mild. Some will happen immediately and some will develop over time. Patients will often stop taking medications because of side effects. The most common side effects are anorexia, nausea, vomiting, constipation, drowsiness, and diarrhea. Toxic effects will often develop after prolonged intake of a medication or when a medication will accumulate in the blood because of either impaired metabolism or excretion. Excessive amounts of a medication in the body will sometimes have lethal effects on the individual depending on the medication's action. Medications may cause unpredictable effects such as an idiosyncratic reaction. This is where the patient overreacts or underreacts to a medication or has a reaction that is different from normal. Allergic reactions are unpredictable responses to a medication. Some individuals become immunologically sensitized to the initial dose of a medication. With repeated administration and exposure, the patient can develop an allergic response to the medication, the chemical preservatives, or a metabolite. The medication or the chemical agents, like the antigen, triggers the release of antibodies in the body. A patient's medication allergy symptoms will vary depending on the individual as well as the medication. For mild allergic reactions, the nurse will watch for urticaria, which is hives, rash, which are small raised vesicles that are usually red, pruritus, which is itching of the skin, rhinitis, which is an inflammation of the mucosal membranes that line the nose. Medication tolerance is not the same as medication dependence. There are two types of medication dependence. One is physical and one is psychological. With psychological, the patient desires the medication for the benefit. Other than that, that is intended. For the physical dependence, this is a physiologic adaptation to the medication that will manifest itself by intense physical distribution when the medication is withdrawn. An individual that is dependent on alcohol will routinely require a higher than usual dose of medication for them to have the desired medical effect. A postoperative patient is receiving morphine sulfate via a patient-controlled analgesia. The nurse assesses that the patient's respirations are depressed. The effects of the morphine sulfate can be classified as allergic, idiosyncratic, therapeutic, or toxic. The answer is D. Toxic effects often develop after prolonged intake of a medication or when a medication accumulates in the blood because of impaired metabolism or excretion. Excessive amounts of a medication in the body sometimes will have lethal effects depending on the medication's actions. An example are toxic levels of morphine, which is an opioid. This will cause severely depressed respiratory in individuals and potentially death. The therapeutic range occurs between the minimum effective concentration and the toxic concentration. Medication is administered repeatedly so that its serum level will fluctuate between doses. The highest dosage level is called the peak concentration, and the lowest dosage level is the trough concentration. After reaching the peak, the serum concentration of the medication will fall progressively. Medications have what's a biologic half-life. This is the amount of time it takes for the excretion process to lower the serum medication level by half. The plateau is when the blood serum concentration of the medication has been reached, and it is maintained after repeated fixed doses of the medication. The easiest and the most common route of medication administration is oral. Medications that are given by mouth and then they're swallowed with adequate amount of fluid. These medications have a slower onset of action and a more prolonged effect than parenteral medications. Patients will routinely prefer the oral route. Sublingual is a medication that is absorbed after being placed under the tongue to dissolve. A nurse should instruct the patient not to swallow the medication that is given by sublingual route or drink anything until the medication is completely dissolved to ensure that the medication will have the desired effect. An example of a sublingual medication is nitroglycerin. The parenteral medication administration involves injecting the medication into the body tissues. An intradermal is injected into the dermis just under the epidermis. Think about a TB shot. The subcutaneous is injected into tissues just below the dermis of the skin. Think about insulin. Intramuscular is injected into a muscle. Think about a shot for pain. And an IV or intravenous is injected directly into the vein. This has the fastest administration as well as route within the system because it becomes systemic almost immediately. An epidural is administered in the epidural space via a catheter. This catheter may be placed by a nurse anesthetist or by an anesthesiologist. This is used to administer regional anesthesia for surgical procedures, and nurses that have advanced education in this type of medication are allowed to administer an epidural. An intrathecal, this is for physicians and special trained nurses. This is administered through a catheter that is surgically placed in the subarachnoid space or in one of the brain ventricles. The intrathecal medication administration is routinely long-term. Intraosseous involves infusing the medication directly into the bone marrow. This may be used in infants and toddlers who have poor access to the intravascular space or with an emergency situation and an IV cannot be accessed. An intraperitoneal is absorbed into the circulation. These types of medications may be chemo agents, insulin, or antibiotics. An intrapleural is a syringe and needle or a chest tube that is used to administer medications directly into the pleural space. Chemo agents are the most common of medications that are administered in this fashion. Pleurodesis is when physicians instill medications that resolve persistent pleural effusion to promote adhesion between the visceral and the parietal pleura. Intra-Arterial is when medication is administered directly into the arteries. This would be common with patients that have arterial clots or that are receiving clot-dissolving agents. Other medications that are limited to physician administration are intrathoracic, which is the medication injected directly into cardiac or heart tissue, and intra-articular, which is injection into a joint. With topical administration, medications may be applied to the skin or the mucous membranes, and they routinely have local effects. A topical medication is applied by painting or spreading medication over an area, applying moist dressings, soaking body parts in a solution, or through medicated baths. Systemic effects occur if the skin is thin or broken, and the medication concentration is high, or contact with the skin is prolonged. Topical medications can use a transdermal disc or a patch, like nitroglycerin or scopolamine. These have systemic effects. The disc will help to secure the medication to the skin, and it is routinely left in place for 12 hours up to 7 days, depending on the type of medication. The inhalation route involves deeper passages of the respiratory tract. These provide a large surface area for medication absorption. The nurse will administer inhaled medications either through nasal or oral or endotracheal or tracheostomy tubes. The intraocular route is inserting medication into the patient's eye. Safely administering medications requires the nurse to have the ability to determine medication doses accurately and measure medications correctly. One careless mistake in placing a decimal point or adding a 0 to the dose can lead to a fatal error for the patient. The nurse should check every dose carefully before giving any medication. Johns Hopkins researchers have estimated that more than 250,000 Americans will die each year from medical errors. As a nurse, you need to know how to calculate medication doses correctly and accurately. You need to be able to apply knowledge and critical thinking to ensure safe medication administration for your patient population. Converting measurements for medications within one system is easy. In metric system, we simply multiply or divide. To change milligrams to grams, you can either divide by 1,000 or move the decimal point 3 points to the left. To convert liters to milliliters, you can multiply by 1,000 or move the decimal point 3 points to the right. Dosage calculation methods include ratio and proportion, formula, and dimensional analysis. You, as the nurse, need to use the method that makes the most sense and is logical for you. You need to use this method all the time, so make it consistent. Before you begin any dosage calculation, you should make a mental estimate of the approximate as well as reasonable dosage. If your estimate does not closely match the answer that you actually calculate, you need to recheck the math before preparing and administering any medication. To prevent medication errors in children, we only use the metric system on prescriptions, medication labels, and dosing instruments. We never administer medications using household spoons. Round all dosing instructions to the nearest 1/10, half a milliliter, or 1 milliliter. Provide education using hands-on demonstration and return demonstration. You should consider using picture-based education if the individual has low literacy. Most pediatric medications are ordered in milligrams per kilogram. The patient needs to be weighed in kilograms before administering any medication. We avoid at all costs converting the patient's weight from pounds to kilograms so that we may prevent errors. There are specific guidelines for telephone and verbal orders. Only authorized staff will receive and record any either telephone or verbal orders. The agency has a policy that identifies in writing the staff who is permitted to do this. You need to clearly identify the patient's name, the room number, and the diagnosis. All orders from the healthcare provider should be read back. If there are any questions so that misunderstandings are avoided, you should use clarification. If it is a telephone order, you use the acronym capital T-O. If it is a verbal order, the acronym capital V-O is used. This should include the date, the time, the name of the patient, and the complete order. As the nurse, you will sign the name of the healthcare provider, and then you will sign your own name. Some policies may require two nurses to listen to telephone or verbal orders, and then they both need to sign off. If a registered nurse writes an order, routinely the agency policy is within 24 hours, the healthcare provider will co-sign the order within that time frame. A standing order is carried out until either the healthcare provider cancels it by another order or the prescribed number of days has diminished. Standing orders indicate a final date or number of treatment or doses of the medication. A PRN order is medication that is to be given when the patient requires it. A single order is a medication that is given once at a specific time. This is commonly seen for preoperative medications or medications given for diagnostic examinations. A stat order signifies that a single dose of the medication is to be given immediately and only once. Stat orders are routinely written for emergencies when the patient's condition changes rapidly. A now order is more specific than a one-time order, and this is used when the patient needs a medication quickly, but not right away, like in a stat order. When receiving a now order, the nurse has 90 minutes to administer the medication. The prescription includes more detailed information than the medication order because the patient needs to understand how to take the medication when they leave the facility and when the prescription needs to be refilled if the prescription was written for refills. This is an example of a medication administration. Note the patient's name, address, age, and the date are printed for identification. You notice that there's a DEA number, which is by the Drug Enforcement Agency. It is a number provided to people that have passed specific tests and are allowed to prescribe medications. You note that there is a medication where it has the name of the medication, it has the amount of the medication, and then it has the dosage of the medication. So that is amoxicillin 500 milligrams. It is one tablet, and it is to be given 3 times a day for 10 days. There is always a signature required on a prescription. As a nurse, when we are providing medication administration, we need to make sure that the orders from the prescriber are adequate and correct. We want to make sure that if we are educating our patient, that we teach them how to self-administer. Think of insulin. We determine when the medication is to be given. So we have a half an hour before and a half an hour after to give medications. A nurse needs to administer medications appropriately and accurately. Before providing any medication, the nurse needs to know the effects of that medication so they know what to look for in their patient's condition if the condition changes. Medication administration is never delegated to someone that does not hold a nursing license or a medical license. Most hospitals now have an automated dispensing system of some sort. It can be a drawer that pops out and it'll have a whole drawer full of the medication, and you take the medication that is necessary for the patient. It may be a drawer that pops out and it may be the correct number of pills for that given time or injections, depending on what is necessary. Preventing medications is the only way to promote safety. We are the last line of defense for our patients. It is up to us as the nurse to make sure that we do not have any medication errors. So one of the easiest things to do that we need to do is we will read the medication label on the container at least 3 times. We will compare it with the medication administration record. We do this when we remove the medication from its place of storage before we take the medication to the patient's room, and then before we administer the medication to the patient. It is our responsibility to ensure patient safety. If for some reason an error occurs to a patient, the first thing that needs to be accomplished by that nurse is to assess that patient's current condition. Once that is done, we will notify the healthcare provider. We want to make sure that we tell the healthcare provider who the medication was given to, what the medication was, and their current signs and symptoms, if any. The doctor will provide a verbal telephone order for the patient. You will need to be prepared to take down that order. An incident report will be prepared, and depending on the institution, it may be considered a near miss or a sentinel event. As you can see, Esther was very independent before her surgery. And now Emilio realizes that Esther may become discouraged when she gets home. She's going to need some form of help at home until she completely heals from her surgery. Throughout their discussion, Emilio has discovered that she has a very strong sense of spirituality. So he encourages her to use her spirituality-based coping mechanisms when she gets home. He also starts thinking about community resources if she should need any assistance. If a nurse experiences a problem reading a physician's medication order, the most appropriate action will be to call the physician and verify the order, call the pharmacist to verify the order, consult with other nursing staff to verify, withhold the medication until the physician makes rounds. The answer is A. We need to make sure that if the medication order is not understood the way it is written, that the physician is called to verify the medication order. It is not up to us as nurses to determine that that patient can wait to receive that medication until the physician makes rounds. Medication administration requires strong critical thinking. The nurse will base the critical thought process on their knowledge that they have gained when they were in school. They're using their experience or their skill set that they learned when they were in school. They want to make sure that when they are doing medications, that they are in a quiet place, that they take their time, because the nurse knows that the nurse is responsible and accountable for all their own actions. There are 7 rights for medications. It needs to be the right medication at the right dose to the right patient using the right route at the right time, providing the right documentation, and making sure that the right indication is there for the patient to receive the medication. As a nurse, it is up to you to ensure the patient's safety. Critical thought when providing medications to any patient is vital. Nurses are legally required to document medications that are administered to patients. The nurse is mandated to document which of the following: medication before administering it, medication after administering it, rationale for administering it, prescriber rationale for administering it. The answer is B. The nurse will never document that they have given a medication until the nurse actually gives the medication. The nurse will document the name of the medication, the dose of the medication, the time the medication was administered, and the route of the medication administration. They will also document the site of any injection, and they will document the patient's response to the medication. When we assess our patients, we realize that our patients have their own rights. They have the right to be informed of the name and the purpose as well as the action of the medication. They also need to know any undesired effects. Therefore, the nurse needs to make sure that she knows all of this information prior to going into the patient's room. The patient has the right to refuse any medication, no matter the reasoning. The patient has the right to have a qualified nurse or a medical personnel with a license assess a medical history, including the allergies and the use of herbals. The patients have the right to be advised of any experimental medication therapy, and they must provide written consent to be part of the experiment or the clinical trial. The patient has the right to receive labeled medication safely without discomfort using the 7 rights of medication administration. The patients have the right to receive appropriate supportive therapy that is related to their medical therapy. Patients have the right to not receive unnecessary medications. The patients have the right to be informed if that medication they are receiving is part of a research study or a clinical trial. Based on the case study information, what do you believe Emilio should include in the teaching care plan for the patient? Consider that the older individual's body undergoes structural and functional changes that may alter the medication actions and influence how the nurse provides medication therapy. The nursing assessment provides data about the patient's condition, their ability to self-administer any medications, as well as the medication compliance. This data is used to determine the patient's actual or potential problems with the medication therapy. There are specific data that are assessment findings that, when the nurse clusters that information together, help reveal the actual nursing diagnoses. Using the nursing process, the nurse should always organize their care activities to ensure the safe administration of all medications. They should never rush to give patients medications because that is unsafe practice and it can lead to medical errors. The nurse must realize the importance of minimizing any distractions or any interruptions whenever they are getting medications ready or preparing them, and then administering the medication to the patient. The nurse needs to plan or prioritize their care when they are administering medications. They want to use the patient assessment data to determine which medications need to be given first, whether it is time or not to evaluate the patient's response to the medication, or whether it is appropriate to administer any PRN or as needed, as required medications. The nursing interventions will actually promote adherence to the medication therapy and foster independence in the patient. The nurse should teach the patient and the family caregiver about the benefit of the medication and the knowledge that the patient and the family member needs so that it is taken correctly. The nurse should integrate the patient's healthcare beliefs and their cultural practices into the treatment care plan. The nurse should help the patient and the family member establish the medication routine that fits into the patient's normal schedule. The nurse should also make any referrals necessary to community resources, as some patients are unable to afford their medications or they may not have transportation to get their medications. So it is up to the nurse to make any necessary community referrals. This slide is taken directly from your textbook, and it shows the effects of aging related to the medication metabolism. We know that older adults, their physical processes start to slow and diminish, and that is something that must be remembered when we are administering medications. Older individuals, depending on where they're at, so if they are in a long-term care facility, they may have what's called polypharmacy. This is when multiple medications are used, and some of the medications may be inappropriate or unnecessary, and the medications that are used do not actually match the patient's medical diagnosis. How should Emilio evaluate the teaching strategy that was used in this case study? Evaluating the medication administration and its effects is a vital role of the professional nurse. It requires the nurse to use their assessment skills, their critical thinking, their analysis capabilities, as well as the knowledge of the medications, physiology, and pathophysiology. The nurse needs to thoroughly and accurately gather data to complete a holistic evaluation. As a nurse, we realize the goal of safe and effective medication administration is met when the patient responds appropriately to the medication therapy or assumes responsibility for their own self-care. Most tablets, pills, and capsules, they need to be swallowed, and there needs to be an administration of anywhere from 60 milliliters of fluid to 240 milliliters of fluid. One important medication precaution to take before administering any oral prescriptions is to protect our patients from aspiration. The nurse realizes that aspiration occurs when any food, fluid, or medication that is intended for gastrointestinal administration mistakenly enters the respiratory tract. When the nurse is taking a medication history or reconciling any medications, they need to specifically ask patients if they take any medications in the form of a patch, a topical cream, or any other route other than an oral route. Before applying a transdermal patch, the nurse needs to ask the patient whether or not the individual has a patch existing on their body currently. The nurse needs to wear clean exam gloves when removing and applying any type of transdermal patch. If the dressing or the patch is difficult to see, apply a label to the patch. The nurse documents on the medication administration record the location on the patient's body where the cream was placed. The nurse will also, if it was a patch, document the removal of the patch on the medication record and in the nursing notes. The most common form of any nasal instillation is using a decongestant spray or saline drops that are often used to relieve symptoms of sinus congestion or colds. The nurse realizes, though, they need to caution the patient to avoid abuse of these medications because the overuse of nasal sprays can lead to a rebound effect where the actual nasal congestion worsens. The nurse needs to ensure that they educate patients and family about the proper technique for administering any eye drops. They should have the patient or the family do a teach back so that way the nurse can judge the patient's ability to self-administer their own medications. The nurse should make sure that the patient is shown each step for instilling their eye drops, so that way they can better understand how to perform the procedure. When providing ear medications, the ear must be manipulated depending on the age of the individual. If the individual is an adult or a child older than the age of 3, the ear canal needs to be straightened by pulling the pinna of the ear up and back to the 10 o'clock position. If the individual is a child under the age of 3, the pinna of the ear needs to be pulled down and back to the 6 o'clock to 9 o'clock position. This helps straighten the ear canal so the medication reaches its entire destination. Comparing the vaginal suppository and the rectal suppository. Vaginal suppositories are always going to be larger and more oval shaped than a rectal suppository. For instilling any rectal suppository, as a nurse, you should help the patient assume the left side-lying Sims position with the upper leg flexed upward. You want to make sure that you remove that suppository from the foil wrapper, and it should be lubricated prior to installation with a water-soluble lubricant. You should also lubricate the gloved index finger of your dominant hand. This permits easier insertion. If the patient has hemorrhoids, especially if they're exposed, you want to make sure that you use plenty of lubricant. Use your smallest finger possible to insert that suppository into the patient's rectum. Pressurized meter dose inhalers, breath actuated meter dose inhalers, and dry powder inhalers. All of these will deliver medication that produce local effects on the lungs like bronchodilation. Some medications will create serious systemic side effects. So you need to make sure as a nurse that you understand the potential side effects of the medication that you're going to administer. With a pressurized meter dose inhaler, a spacer is used. A spacer is a tube that is roughly a little over 10 to 20 centimeters or 4 to 8 inches. This attaches to the inhaler. It allows particles of the medication to slow and break into smaller pieces. This will help the medication get deeper into the lungs of the patient, and it will also enhance their absorption. The breath actuated and the dry powders do not use a spacer. When instilling any irrigations, you should have the water tepid, not room temperature. It's going to be very chilling to the individual. And you want to make sure that you use clean technique. Parenteral medication administration will utilize a needle and a syringe. There are various types of syringes in the photo. A is a 5 millimeter syringe. B is a 3 millimeter syringe. C is a TB or tuberculin syringe that is marked in 0.01 or hundredths place for doses less than 1 milliliter. D is a syringe that is specific to insulin, and it is marked in units. Parenteral administration of medications is the use of an injection into a body tissue. Giving an injection is considered an invasive procedure. That means that the nurse will use aseptic or sterile technique. Because we understand as nurses that the risk of infection is there once the needle pierces through the skin. In A, you can visualize a carpujette syringe with the pre-filled sterile cartridge that already has a needle attached. In B, you can see that they are assembling the carpujette, which is basically placing the sterile cartridge into the carpujette. The carpujette will slide into the into the syringe barrel, which would be C. You will turn and lock the syringe into the cartridge. Then you will, as in D, screw the plunger into the cartridge. Depending on the medication, you may need to rid the syringe of the air that is in it. If some medications require the air to remain to ensure that the patient gets all the medication, you need to know which medication you're providing and how it is to be given. This is an example of a medication in an ampule. An ampule is glass. You want to make sure that you use gloves and use either a 4x4 or an alcohol prep pad. At the neck of these ampules, they are scored. You will hold it in one hand, use your thumb and your fingers, put your thumb on the neck of the bottle with the prep pad or the 4x4 in your hands and wrapped around it. You will break that bottle away from you to help prevent you getting cut. This is safety for nursing. This is an example of medications in a vial. Vials will either contain dry powder, they can contain pills, they can contain liquids. If it's a dry powder, you would need to read the label to determine how much of a liquid is to be instilled, so that way the medication is able to be provided. Some vials will be single dose and some vials will be multi-dose. If they are multi-dose, you want to make sure that you date them and put your initials. That is the day that you have actually punctured it for the first time. A multi-use vial is good for 30 days. You also need to add the expiration date and time, so that way no one uses medications that are expired. This is a Joint Commission rule, and it is followed stringently in the hospital system. As nurses, we know that sometimes we need to mix two medications. We want to ensure patient safety. We want to ensure that we do not mess up or deter the properties of the medication. So we do not want to contaminate one medication with the other medication. Once we have drawn up the medication that we need, we want to make sure that the final dose is accurate and appropriate. While we're doing this procedure, we will use aseptic or sterile technique because we do not want to introduce any bacteria into the medication, which would then end up in the patient. This is an example of mixing medications. This will be done frequently with insulins. So the way this is done is you're going to have two different solutions. You're going to inject air into the first vial. Then you're going to inject air into the second vial. And you're going to take out the dose of the second vial. Then you're going back to the first vial, and you are now withdrawing the amount of medication you need from the first vial. With this procedure, we want to make sure that we're using a needleless or a needle with the syringe. Once you have mixed medications from two vials, you need to change the needle. The needle will become dull, and you don't want to pierce your patient with that. Insulin is given into the subcutaneous tissue. Therefore, it is a sub-Q injection. The same technique will be used for any injections. It is all aseptic technique, whether it's an insulin syringe or an insulin pen. The nurse knows that they need to use a body surface area where 1 inch of fat or 2.5 centimeters of fat can be pinched. We will use a 27 gauge needle that is perpendicular to the skin. We do not aspirate the injection, and once we instill the medication, we will hold that needle in place for several seconds. This helps prevent any leakage of that medication in the needle hole. Insulin is absorbed pretty rapidly through the abdominal wall. So the abdominal area is the first choice for the site whenever we're using rapid-acting insulin. Regular insulin is the only insulin that may be given intravenously. Individuals whose blood glucose levels are well controlled on mixed insulin dose need to make sure that they maintain their individual routine whenever they prepare and administer their insulin. They do not want to mix insulin with any other medication or dilute it unless it is approved by the prescriber. Insulins that are long-acting, which is Glargine or Detromir, are never mixed. Rapid-acting insulins that are mixed with NPH insulin need to be given 15 minutes before a meal. A nurse should verify the dose of the medication of insulin with another nurse while you are preparing that medication. Insulin is one of those medications that can cause great harm and death to our patients. In a hospital, Insulin is always verified with the second nurse. Currently in long-term care, verification of insulin injections does not always occur. Receiving an injection is not always a happy procedure for the patient. So because we know that having a needle stuck in you is not comfortable, we work on minimizing discomfort for our patients. You want to make sure that your needle is sharp and that it is in the smallest length and gauge that is suitable for the medication. You want to help position your patient as comfortably as you can, so that way it reduces their muscular tension. You want to make sure as a nurse that you select the appropriate injection site and that you use the anatomical landmarks. Oftentimes, it's best to assist to divert the patient's attention. Getting them to talk is one way, using open-ended conversations, and just keep going about your business. And don't say, okay, you're going to feel a prick now. Okay, they know they're going to get an injection. Just continue with your job and talking to them at the same time. That is the way to easily relax your patients. You want to insert that needle quickly and smoothly because we don't want to pull on that tissue. You want to make sure that you're able to hold that syringe steady while that needle is inside of the patient. And you need to inject the medication steadily but slowly. These are the sites that are recommended for subcutaneous injections or sub-Q injections. The best sub-Q sites include the outer posterior aspect of the upper arm. We know that the abdomen is the first or the fastest absorption rate. The abdomen is below the costal margin to the iliac crest. We also will use the anterior aspects of the thigh. The site that is most frequently recommended for injection into the abdomen is the medication heparin. Heparin is an anticoagulant that needs to interact with the body system rapidly. These angles of insertion are what are used whenever we provide injections for our patients. The intramuscular injection is at 90 degrees. Notice the subcutaneous injection. It can actually be 45 degrees to 90 degrees. It depends on the depth and the amount of the subcutaneous tissue. The intradermal injection, 15 degrees are used to provide that. It only goes underneath the skin. For an intradermal, think about a TB test. So when we are giving an injection, nurses will routinely use a 25 gauge 5/8 inch needle. Okay, it will be inserted at a 45 degree angle. Or the nurse will use a 1/2 inch needle that is inserted at a 90 degree, depending on the depth of the patient. To ensure that the subcutaneous medication reaches its desired location, which is the fat tissue, you need to understand this rule. If you can grasp 2 inches of tissue, insert a needle at 90 degree angle. If you can only grasp 1 inch of tissue, you want to use the needle and insert it at a 45 degree angle. Insulin injection pens are a technology that provide patients an easy self-administration of medication. Think about an EpiPen or an insulin pen. These pens, injection pens, are a convenient delivery method that are pre-filled, and they usually have disposable cartridges. The patient will pinch their own skin, insert the needle, and then inject a predetermined dosage medication. We want to ensure that the patient understands how to correctly inject the medication as well as provide the correct dose. We want to teach our patients the importance of purging the pen before a dose is given. There are also new things that have come out. One is a needleless jet injection system. This administers subcutaneous medications without using a needle. These needle-free injections use high pressure to penetrate the skin with the medication into the subcutaneous tissue. There is also a subcutaneous injection or an infusion type device. This is pre-inserted into the subcutaneous tissue. The needle is put into this specific site, then it is removed, leaving the cannula in place in the tissue to provide a way to administer the medication for 3 days without having to puncture the patient's skin with each injection. The intramuscular or IM injection puts medication into deep muscle tissue. This muscle tissue has a rich blood supply that permits the medication to absorb faster than by the subcutaneous route. There is a risk for injecting the medication directly into a blood vessel. Any factor that interferes with local tissue blood flow will affect the rate as well as the extent of the medication absorption. If a medication is not injected correctly into the muscle, there can be complications like an abscess, hematoma, ecchymosis, pain, vascular or nerve injury. The viscosity of the medication or the thickness of the medication, like syrup, the injection site used, the patient's weight, as well as the amount of adipose tissue will influence the size of the needle that is to be used. The nurse always will assess the muscle before giving an injection. You want to make sure that you properly identify the site for the intramuscular injection by palpating the bony landmarks. And you should be aware of any potential complication associated with the site chosen. The site chosen needs to be free of any tenderness because repeated injections in the same muscle can cause severe discomfort as well as lumps within that muscle. When the patient is relaxed, you should palpate the muscle to rule out any hardened areas. When injecting a medication to an intramuscular site, the Z-track method is the preferred method for injection. So this is in a large, deep muscle like the ventral gluteal. You would pull the skin and the subcutaneous tissue laterally to the side with the ulnar side of your non-dominant hand. You want to hold the skin in this position until you have administered the intramuscular injection. You want to make sure that you keep that needle inserted for around 10 seconds to allow the medication to disperse evenly in the muscle. Then you're going to release the skin after you pull out the needle. This will leave a zigzag path It helps seal the needle tract whenever the tissue planes slide across each other. The medication is then sealed inside of the muscle tissue. This is the ventral gluteal site. It is, as you can read, is the preferred and the safest site for adults. The V method is commonly used. So this is a ventral gluteal site using your hand. You need to position the patient either supine or lateral with a knee and hip flexed. You're going to use your right hand for the left hip and the left hand for the right hip. You're going to place your palm end of your hand on the greater trochanter on the femur. You're going to move your thumb toward the patient's groin, and your index finger will be toward the anterior superior iliac spine. Then you will extend or open the middle finger along the iliac crest toward the patient's buttocks. The point between the index finger and the middle finger and the iliac crest will now form a V-shaped triangle. Your injection site is the center of that triangle. The Vastus Lateralis can also be used, and it is often used in infants, toddlers, and depending on the size and the age of the child. So you look at the thigh and you divide this thigh into sections of 3. So there's 3 rows and 3 sections in each row. You're going to use the middle third of the muscle to inject the medication. The muscle width usually extends from the midline of the thigh to the midline of the outer side of the thigh. Before choosing the deltoid, you need to determine the amount of medication that is going to be instilled into the patient. You need to make sure that you understand the landmarks and that this deltoid muscle needs to be well established, because there is potential for injury at this site. The axial, radial, brachial, as well as ulnar nerves and the brachial artery are in the upper arm, under the triceps, and along the humerus. Therefore, the nurse needs to assess the condition of the deltoid muscle. You need to make sure you know what the medication is, as well as the amount of medication that you're instilling. And you need to be able to locate specific anatomical landmarks. This site is only used for small medication volumes. Less than 2 milliliters of medication is to be instilled into a deltoid muscle. This is a site that is used routinely in immunizations for children that are toddler stage through adulthood. The landmarks for the deltoid site. This injection site is in the center of the triangle. You can see where you have the acromion process, and you put your hand on that deltoid. You can feel the acromion process. You should roughly be 2 finger breaths below the acromion process. If not, you're likely to hit that patient's bone, and it's not going to feel very good. Intradermal injections will use a tuberculin or a small hypodermic syringe for skin testing. The angle of this insertion site is from 5 to 15 degrees, and anytime you use or give this injection, the intradermal injection needle is pointed up, so the bevel of the needle is upward. Needles now have plastic guards to prevent needle sticks. We want to make sure that if there is a needleless system in place, that we don't use a needle. The nurse should never, ever recap a needle after medication administration. You should know how to handle and dispose of needles safely before you use a needle. Once you have used that needle, you want to dispose of it appropriately, and there will be a puncture-resistant as well as a leak-proof sharps disposal container nearby. If you happen to get stuck, you will fill out an incident report. You will explain exactly what happened, where it happened, and you want to make sure that you give this information to your nurse manager. As nurses, we also attend educational offerings that are related to bloodborne pathogens, and we follow infection prevention guidelines. Any needle stick or sharp injury needs reported immediately. In all of these methods, the patient either has an existing IV infusion running continuously or an IV access site for intermittent infusions. The agency policy will determine who can administer medications through the IV. When using any administration of IV medications, you want to make sure that you as the nurse will observe the patient for signs and symptoms of any adverse reactions. That is why it is important for the nurse to know the medication that they're giving and what could be potential side effects or adverse effects. After this medication is instilled, it enters the bloodstream directly. That means it acts immediately, and there is no method of stopping the action of this medication. There are best practice standards for administering an IV solution and medications. As a nurse, you should always review the medication orders for the standardized concentration as well as the dosage of the medication. You're using a standard procedure for ordering, preparing, and administering any IV medications. You administer solutions or medications that are prepared and dispensed from the pharmacy or as commercially prepared whenever possible. As a nurse, we never prepare high alert medications such as heparin, dopamine, dobutamine, potassium, nitroglyceride, any antibiotics, or magnesium on a patient care unit. We make sure that we review the medication order so that we know the standardized infusion concentrations of high alert medications. There are standardized storage of IV medications. We should be checking the medications for safety using CATS per. We should be checking compatibility, allergies. Is the tubing correct? Is the site checked? Is the pump safety checked? Is it the right rate? Is the release clamped? Will we return and reassess our patient? There are standard labeling practices that are used. There should be bolded patient name and generic medication name as well as patient-specific dose. An IV bolus or an IV push medication is the most dangerous method of administering a medication because there is no time to correct an error. A bolus may cause an irritation to the lining of the blood vessels. Before administering a bolus, the nurse needs to confirm the placement of the IV line and make sure that it is patent. You want to look at the site and assess it. Is it swollen or edematous? Is the IV able to flow at the proper rate? An accidental injection of a medication into the tissues around a vein can cause pain for the patient, sloughing of tissue, and abscesses, depending on the composition of the medication. When we're talking about volume-controlled infusions, these are routinely small amounts. The fluid is within or using a secondary fluid container that is separate from the primary fluid bag. For instance, hanging in an antibiotic using an IV piggyback. An IV piggyback is a small IV bag, anywhere from 25 to 250 milliliters, or it can be a bottle that is connected to a short tubing line that connects to an Y port on the upper end of the primary infusion line, or it can be connected to an intermittent venous access site. The label on the medication needs to be checked prior to providing the medication. The piggyback tubing is either a micro drip or a macro drip tubing. The set is called a piggyback set because this bag is small or the bottle is higher than the primary infusion bag or bottle. In a piggyback setup, the main line does not infuse when the piggybacked medication is infusing. The port of the primary IV line routinely will contain a back check valve that automatically stops the flow of the primary infusion site once that piggyback medication is infusing. And then we use the process of gravity with the piggyback being set higher than the main line for the IV infusion. This is an example of an IV medication piggybacked, and you can see that it contains all the necessary information. It has the patient's name, it has identifiers, it has the medication, it has the dose of medication, it tells how much is in this bag, it tells what is the solution that it is mixed with. It states that it is a piggyback solution. You can see it has an expiration date. It has the pharmacist's initials or the pharmacy tech who got the medication prepared. It tells how long to infuse this medication. A volume-controlled administration set may also be known as a buretrol. These sets are small. There are 150 ml containers that attach just below the primary infusion bag. This set is attached and filled similarly to that when we're setting up for a regular IV infusion. The syringe pump is a battery-operated machine that allows medications to be provided in small amounts of fluid, either 5 to 60 ml, with a controlled infusion time using standard syringes. Routinely, the medications are anywhere from a 30 to a 60 ml syringe. An intermittent venous access, also known as a saline lock, is an IV catheter cap that screws on to the IV tubing. On its end, it is a small chamber, and it has a rubber diaphragm or a specific design cap on it. Before administering any IV bolus or piggyback, the nurse needs to assess the patency as well as the placement of the venous access site. After the medication has been administered using the intermittent access port, the access site must be flushed with a solution to keep it patent. Routinely, it is normal saline that is used for an effective flush for any peripheral type catheter. Flushing of a peripheral catheter or a saline lock roughly will be 5 mL of solution. That clears the cap and clears the tubing that is inside your patient. Occasionally, patients may need IV therapy at home. Common infusions that some patients may receive might be an antimicrobial, chemo, total parenteral nutrition, could be IV therapy. Patients that receive their IV therapy at home, they routinely have what's known as a long-term central venous line, or known as a central venous catheter. The nurse is the last step in safety for patients that are getting medications administered. It is vital to ensure that all the patient information is correct, using the 7 rights for patient administration, right? Name, dosage, route, time, reason, okay? Patients need to make sure that their nurse is accurate. So the nurse will check for accuracy 3 times. The first accuracy check is when the medication is pulled or retrieved from the automatic dispensing machine, the medication drawer, or the system that is being used. The second check is when the medication is being prepared for administration. And the third and final check will occur at the patient's bedside just before the medication is provided. Remember, as a nurse, we are the patient's last step of safety with medication administration in medical facilities. We need to be diligent, we need to be accountable, we need to be responsible. We need to make sure that we are providing safety anytime we are dispensing or instilling medications into our patients.